Well, thank you so much for having me here. My first child, Amy, was a pocket rocket. I gave birth to a pocket rocket. Um, and this is Amy when she was 14. She was just about to make a journey over to America to get a diagnosis. Um, she was very premature. She weighed £2.11. Nobody suspected, I don't think there was anything wrong, although they had done some genetic testing because she was small for dates inside. And then she didn't grow. She didn't want to feed, and she developed tremors, etc., etc. So I was right into all of the children's genetics departments across the country, and believe me, we travel the country up and down to be told you're over anxious, go back to your local team. So, cut a long story short, one of my neighbours asked me one day, what is wrong with Amy? Well, we don't know. So I'd found what I thought it was when she was 5 on the internet, and that was Cockayne syndrome, but she lacked one of the criteria, which was photosensitivity. As it eventually turned out, she was ionizing radiation was damaging her DNA. So trying to be listened to was very, very difficult. Anyway, cut long story short, again, the guy across the road said, I know somebody that runs a hospital over in the States. Do you want me to get in touch with them, and shall we see if they can help? So within 4 weeks, we were on our way, and here she is with a suitcase all ready and excited to go. So this is Cockayne syndrome. This is Thomas, and here he is, aged 3 weeks old, £9.6. You wouldn't think there was a problem, would you? Age 3, he was wearing glasses, and he'd said a couple of words, he'd taken a couple of steps, but then it had stopped. Age 6, he was obviously very much changing, and age 9, he passed away. So this is a DNA repair disorder that leads to premature aging. Okay, so I'm going to jump forward in time now, because the journey was a hard one, a really difficult one, and trying to get ourselves listened to was very difficult. They'd said that Amy had Amy syndrome, that she'd be the only person in the UK with it. Just get on with it. She'll probably die young. And I said, no, I'm not having that. I want to know exactly what's going wrong with her. I'm not medical. I used to run pub restaurants, but I can talk, thank goodness. So I spoke at the Houses of Parliament on Rare Disease Day one year and said that and I'm going to be very blunt here, so I apologise to everybody, I did not want to hold dead babies anymore. This was wrong, what was happening to the children and to every member of the families. And I said, if anyone can help us in any way, because there's no treatment and there's no cure, please can you come forward? So luckily for me, a lady in the audience came forward and said, I'm going to help you. So 10 years of help, 10 years of working together. I followed 10 families around the UK, going to every hospital appointment. And believe me, there was lots of hospital appointments. With Amy, I was in hospital about 3 times a week with everything that was going wrong with her. So the lady that I spoke to, Dr. Shala Mohammed, said, I'm going to try and help you set up a clinic, a specialised clinic. So, as I say, I followed families all around the UK, and we were in and out of hospital appointments, and I was converting that to monetary terms for the family and monetary terms for the extended family, because obviously the family had to get care for other siblings, etc., and how much that was costing the NHS. And then knowing that once we got the clinic, we were saving the NHS 4 million. If that's not a good advert for a specialised clinic, I'm not sure what is. So here's some of the children that come to clinic with our volunteers. I think you can agree that despite what the children go through and despite their life expectancy is average age 12, they're all smiley and absolutely gorgeous. So at clinic, we set it up as if it's party atmosphere. For the children that are affected by the illness, well, who's affected by the illness as the children? It's both the siblings and the children that have these illnesses. So we make sure that the siblings are included. We have the glue and the glitter table. We put all sorts of fun out. And those kids love coming and don't want to go home, and neither does the parents. So I think we cracked it. Okay, so this is it. We we want people to be educated by our children, we do, and we also want people to be trained. So if anybody's interested in coming down to clinic with me, please do. London, Guy's and St Thomas was the first clinic that was opened, and the second clinic was in the Netherlands. It was based on the blueprint of our clinic, and then we're heading off to Japan to help the Japanese government. We can't do that unless they pay for us to go over there, because we're a small charity that we really rely on funding coming in. But every time a child goes along to clinic, they are given a blood test to get a baseline of what's happening, what's going on there. You know, are they, because they're photosensitive generally, do they need different sorts of vitamins, you know, vitamin D, because they can't go out into the sunlight, etc. So we're really actively researching with the children that are going to clinic. And clinic is from diagnosis to death. So they're kept there constantly, regardless of age, which is a really good thing. We've been able to access loads of information research-wise. I'm just going to hold this up because we managed to develop our own growth charts. The children don't grow very much. They're very underweight, but they're very underweight for regular people. They're not very underweight for this illness. And outside, locally, dietitians were trying to force feed the kids. Children were being taken off parents, put into care, etc., etc. Now, you might think that was, you know, quite a while ago, because that we're 2025, but no, because last month we had a child that had been taken away from their family. This baby was born with cataracts, very, very small, had to wear hearing aids, wasn't meeting any milestones, wasn't feeding, was taken into foster care and then taken and made a ward of the hospital. Luckily, we managed to get the team from the clinic involved, and now he's back home with his parents, where he belongs for the short time he's got, because he's a very severe little baby. So when families go to hospital, we've got this growth chart, so they can see that actually they're not off the bottom of the page. They are following a curve and it's all good. So actually you don't need to pump them full of formula. And also we've developed our own passports, which are invaluable really, because when you're going into hospital with a child with a rare disorder, by the time you've finished telling the story of where your child's up to, you know, that they've given up on you really, haven't they? And we'll weigh and measure, come back in 3 months and we'll do it all again. So it's, yeah. Okay, anyway, Jayne, carry on. Okay, so we're a centre of excellence. Yay! How good is that? I've already covered that one, so I'm gonna move on. Okay, so the aims of the service, obviously, we've got the lab services. We started to support Cockayne syndrome because that's what they thought Amy had. And then along with the 100,000 Genome Project and other advances in science, we came across trichothiodystrophy, TTD, which is a very similar mechanism for illness. And also now we've moved on to a couple of different illnesses as well that we're helping, and they're all DNA repair disorders. We've got scientists with us here, so when it comes to question time, I only run a pub restaurant at Ari and Jamal. Okay. What we decided to do was, when we first set up Amy and Friends, we didn't have any doctors in the UK with any knowledge of this condition or in any interest either. So we decided that we would try and keep as much information on patients as we possibly could. And so we started at the top of the head, right down to the bottom of the feet. Little did we know it was going to be everything that was going wrong. So we thought, well, we'll start with the brain. Well, hang on a minute, because the kids lose their hair. So then it's the skin, then it's everything. So we've managed to put together a multidisciplinary team of people who really specialise in this now. None of them had any knowledge of it to begin with, but they have, and we're starting to write leaflets that can be downloadable for the rest of the world. We've found antibiotics that kill the kid's liver within 24 hours, all based on knowledge that we've got together over time. And all of these specialists come to a conference that we have every year. We've got scientists there, clinicians, and they get to meet the patients. And I think it's a really good conference. It's amazing. And, speaking for you, Arian, you get to meet the children who you just look at cells normally, but actually it's converted into this child that absolutely loves you. So hopefully that inspires you on. Okay. I'm going to move on past that because these are the services that we can access while the children are at hospital as well. We can just walk them through to other departments and they're seen straight away. So that's really good too. Okay. As I said before, when we're having this patient support group, we're setting up lots of different activities for the kids, but also we're providing emotional support for parents and siblings. We take with us an anticipatory grief and bereavement support person, and more recently we've done a video of siblings who are severely affected by this. There's no doubt about it. These kids, when their siblings pass away, have to carry on the rest of their lives with what they've seen and what they then go on to experience. And believe me, they suffer, they struggle. Okay, so we all work from home. We don't want to have any overheads. We're not a big charity. It's really difficult to get money in. We sell ourselves, what can I say? We've got a specialist nurse, we've got two, that goes out to do home visits. We go out to give home visits. We give respite to families. And you know what, sometimes I say, what do you want to do? Do you want to go out for a meal? We'll fund you to go out for a meal. No, they want to go to bed and have a sleep. Well, we'll play with the kids while you have a sleep. That's okay. Generally, the child's in bed with them all night, because the child's in pain, etc., etc. So we're trying to provide as much care of what the patients and the parents and the families want, and we listen to them. We are completely user-led, and that's what works. When somebody said something and I think, okay, that's what we need to change, we change, and that's how this grows. Okay, I've gone on. Well, lastly, I'd just like to thank everybody who helps us, and today my book's been published. Okay. You say it's available upstairs, and all the proceeds are going to Amy Friends. And they help us take siblings out, take mums and dads out, let them have a sleep, etc., etc. We don't pay for any research because the researchers thankfully come to us, and we just haven't got the money to do that because it's an endless, bottomless pit. There's no treatment for our children, there's only palliative. So if anybody can come forward and can help us, as I said near the beginning, I don't want to hold dead babies anymore. So if you can help us in any way, please do. And please give this a read because it's been a journey. There's some really good comments in there by clinicians and scientists, but also by patients as well. Oh, and lastly, I am really grateful that I actually did have a child with a rare disorder. We lost Amy in 2020, but by God, she was the life and soul of the party. And you have to get out of bed every day to continue helping children and families like ours. Thank you.